Hello everyone, welcome back to our channel. I'm Dr. Ashmita. Today in this video, let's continue with the chronic viral hepatitis. We shall study about treatment and complications of chronic viral hepatitis. Beginning with the treatment, the general measures that have to be taken in chronic viral hepatitis are is to avoid alcohol and avoid hepatotoxic drugs. Why? Alcohol and hepatotoxic drugs, they'll further increase the damage to hepatocytes, and they'll further increase the inflammation. Therefore, the agents that increase the damage, that increase the inflammation have to be avoided. So, alcohol, hepatotoxic drugs are therefore avoided in already diagnosed cases of chronic viral hepatitis, and vaccinate the household contacts of that patient. These are the general measures to be taken. And specifically coming to the hepatitis B virus, nucleotide analogues are given. The nucleotide analogues are entecavir and tenofovir. These suppress HBV DNA replication. They will suppress the viral genome replication, and the duration of the treatment is long term. It can be either lifetime as well. So, nucleotide analogues prescribed in hepatitis B virus, and for hepatitis C, direct acting antivirals are given like sofosbuvir, that is NS5B inhibitors, and NS5A inhibitors like vel velpatasvir and ledipasvir. This will eradicate the HCV RNA, they will directly eradicate the genome, and the course of this treatment is 8 to 12 weeks depending on the genome. This is about the treatment part of chronic viral hepatitis. Coming to the complications, if the viral hepatitis is left untreated, it may progress to cirrhosis. So, the cirrhosis is water cirrhosis, like chronic progression to fibrosis. It is characterized by bridging fibrosis. All the regenerative nodules surrounded by dense fibrous bands. Multiple that such regenerative nodules are present. And because of this, they're completely surrounding, these fibrous bands are completely surrounding the regenerating hepatocytes, is totally cut off from blood supply. So total collapse of hepatocytes, collapse of the bridging fibrosis occur. That is cirrhosis that we have explained in the clinical features, also morphology also. So cirrhosis is a complication of chronic viral hepatitis. And portal hypertension. Why portal hypertension? Because of bridging fibrosis only. So whenever these regenerating nodules are present surrounded by this bridging fibrosis, these hepatocytes are completely cut off from blood supply. They do not receive the blood supply. So the portal vein that carries blood from the spleen, from the intestine, from the pancreas, this blood, it remains stagnant. They do not enter liver. Hepatocytes do not take up. They remain stagnant in the portal vein. It will result in portal hypertension. Because of portal hypertension, what are the sequelae of portal hypertension that I have said? Explaining clinical features. Because there's a backflow, this is splenomegaly. This is splenomegaly. And there is ascites. Because of this portal hypertension, there will be transudative fluid leak from the splanchnic capillaries into abdominal cavity. That is ascites. And because of portal hypertension, there can be esophageal varices, chances of esophageal varices. All these are the sequelae of portal hypertension. Thirdly, HCC. If, especially with hepatitis B virus, when this hepatitis B virus DNA, it will integrate into the hepatocyte genome, into the host genome, it will suppress the P53 and activate the oncogenes like c-MYC. It will ultimately result in hepatocellular cancer. This is cancer is one of the risk factor or one of the complications, and ultimately liver failure. When liver is left untreated, the ongoing inflammation, ongoing injury, everything, and the collapse, total collapse because of this bridging fibrosis, cut off of blood supply will ultimately result in the liver will give up, liver failure occurs. Extrahepatic manifestations I have discussed in detail under the clinical features of chronic viral hepatitis, wherein there are renal manifestations like membranous glomerulonephritis, membranoproliferative glomerulonephritis, and lymphoid neoplasms like B cell lymphoma, skin manifestations like vasculitic rashes, lichen planus are there because of immune complex deposition in the skin and mucous membranes, and certain other complications like in joints arthralgia, arthritis is seen, and hematological complications like mixed cryoglobulinemia, that is the immunoglobulins they precipitate at cold temperatures. All these are the extra hepatic complications I have discussed under the clinical features also, and it may progress to fulminant hepatitis, which is a rare complication. Fulminant means it's a sudden explosive outburst, sudden worse prognosis occurs. It's a rare complication. It is due to massive necrosis, and it especially seen with hepatitis B and hepatitis D superinfection. As we all know, hepatitis D is a dependent virus, so both occurring together, like hepatitis B on hepatitis D superinfection, it will rapidly progress to failure. That is, it will have a sudden, explosive, or rapidly deteriorating progresses. That is fulminant hepatitis. All these are the complications of chronic viral hepatitis. So, if you like with this, we have done with the chronic viral hepatitis video. So, if you like this video, please like, share, and subscribe to our channel. Thank you, everyone.